Good afternoon. My name is Denise, and on behalf of my colleagues, Dr. Vince Lepak, Dr. Carolyn Cheema, Dr. Mary Hudson, and Dr. Katie Eliot, I'd like to welcome you to our presentation, Exploration of Professional Boundaries as Future Community-Based Practitioners Engage in Interprofessional Teamwork. Our objectives make it clear that we were focusing on an often overlooked area of IPE. While teaming is traditionally presented as something that occurs quite naturally in hospitals, nursing homes, and other places where the patients are there and the team comes in to work with them, things are a little different in the professions where you traditionally practice as a solo practitioner in a single discipline area out in the community. We are all faculty members in the College of Allied Health, which is part of the OUHSC Comprehensive Health Center. We have 7 professional programs, and 4 of them are involved in this activity. These persons who participated were occupational therapy, physical therapy, nutritional science, and audiology. As you can see, these programs are all part of the College of Allied Health, but we don't regularly interact with each other. OT and PT students are spread across Oklahoma City and Tulsa campuses. Nutritional sciences students are in the Oklahoma City and on the Norman campus, and audiology is housed in the Oklahoma City campus. I'm obviously talking to an audience that understands both what it is and why we do it, but let's spend a little bit of time thinking. We are preparing our students not just to know about interprofessional activities, but to be able to perform well when they encounter them in the clinic, and to one day be able to be change agents who integrate interprofessional work into their own practice. Of the 4 competencies, this course chose to focus on interprofessional communication and roles and responsibility for interprofessional practice. We know that the students will practice better and that people will have a better chance of working at the top of their license if they work as a team with the patient at the center. However, there's still times that students struggle. It can be difficult to interact with a team when the team is not readily available. That's the situation private practice clinicians face every single day. It can also be difficult to be part of a team when you need to speak up and define your role, and you're unsure how to do that, or you encounter resistance when you try to do it. Our goal was to take a 1-credit existing course that was a required course in the PT and OT curriculum and expand it so that it applied equally well for nutritional science and audiology students to join us. Our objectives were to take students from these 4 professions who typically do not practice primarily in hospitals and show them how the idea of just in time could work as well with teams as it does for ordering supplies. We rebuilt this course to give students a chance to explore what happens when a traditional hospitalized patient is discharged into the community environment. What happens when you, as a single practice professional, explore the patient's case and realize there are issues that another professional could deal with better? Or, more troublingly, there are things I can do in my profession, but I also know that another profession does similar things but looks at them through a different lens. How would the patient's care be different if I involved that practitioner and created a team that also brought them into the case? The planning stage was extensive. We reached out and invited all 7 of the professions in the College of Allied Health, and we ended up with 4 professions. We invited all the professions to join our course, but due to scheduling, which is a constant problem with IPE, most were unable to. OT and PT were already enrolled in the course. Nutritional science and audiology chose to join with us for an activity, but embedded in their own existing courses. We created the course so that everyone had guides to help the students know what to do, to help faculty know how to facilitate, what points to emphasize, and it was easy for us to feel confident that the same type of activity was happening across every single group, because what we built into this course was the beauty of asynchrony. While the groups met and interacted together live, we allowed them to do that according to the schedule that worked best, as we had occupational therapy and physical therapy students to plan around, as well as their respective faculty. Well, we had to take into consideration that what was free for a particular group of students on a particular campus might not be free time for students on the other campus or in the other discipline. So it worked really well. We also decided that sometimes interprofessional education can be all about the experience of the team, and we never wanted the students to lose track of the most important team member. That would be the patient. So we added some content that addressed an issue of ableism, which was threaded through the interprofessional videos, where the team often functioned well together, but not so well when the patient was a part of it. This slide shows you how we laid things out. For the first 3 sections, it was OT and PT only. We started them off with an activity they did on their own, designed to ensure they understood the competencies we were going to be discussing, which were communication and roles and responsibilities. We gave them activities that were on our D2L page that they were able to work through at their own pace, as long as they finished by the target deadline. And the target deadline was the 3rd week of the course, when we started the first of the 3 small group meetings, and one happened every single week. After the second small group meetings, which were facilitator-led, facilitator-directed, student-led, the students organized their own evening meeting. According to the course materials, they were at the point where the video patient was about to be discharged to receive community-based OT and PT. They realized, after the patient had been in their mock practices 2 or 3 weeks, that the patients had issues in the area of diet, balance, exercise, and activity levels. Each of these areas falls within the scope of PT and OT, but also falls within the scope, and sometimes more deeply within the scope, of audiology and nutritional sciences. We built these experiences in deliberately so that it could create discussions. We created a scenario where the students were required to identify a need to reach out to the nutritional science and audiology students assigned to their team, to have an evening discussion where they talked about the patient and who was better suited for giving them the particular set of skills that they needed. When it was all over, students were given a fieldwork activity and a clinical education activity that they were to look at, and we'll discuss that later. This course lays it out in a different manner. As you can see, the DPT and MOT students were involved in the entire course, whereas audiology and nutritional sciences were a just-in-time insertion. They were brought in when the natural part of the unfolding case required the community-based practitioners to consider, should I bring in other professionals? Should I make those referrals? Would it be for the benefit of my patient? All of our programs believe heavily that a student can know something, and we can test to see that they know something, but until they reflect upon it, they don't make the knowledge theirs. We added a reflection piece and let each of the programs handle it as they saw fit. We wanted this to be an experience that people could tailor to work with their own programs. And as you can see, we overlapped quite a bit in what we expected our students to do in their reflection activity. The reflections from the students showed that they truly benefited, whether they were in the whole course or whether they were only in a small course, from the chance to spend time with people who will be their fellow practitioners. They used words like enriching and eye-opening and understanding the need for respect and even a better understanding of what these other professions who were in their same college actually were going to do after they graduated. We wanted to continue our initial goal, which was to help the student be prepared with the tools to take the knowledge, put it into practice, and then put it into clinical practice. As the semester ended, and it was a short 6-week semester, 3 of the professions were either in the clinic or went immediately into the clinic. Nutritional science had a delay where they continued coursework before they went into the clinic. We encouraged them to do 2 things. First, take a look at, was there teaming going on? Did you see your preceptors reach out to community practitioners, or did you hear them talk about the need to make referrals, the need to call back to the referring provider, the need to reach out to the community services that this person might need? Did they make any effort to involve any other people for a 360 approach to the patient's needs? And then the next part was for the student to reflect. Did this reaching out or the failure to reach out have any impact, or could it have had an impact on the care that the patient received? What made all of this work? As I've said earlier, this was a course with many moving pieces. What really helped us was we reached out to faculty facilitators who were already well-identified IPE champions. We wanted people who understood the importance of it, who understood the competencies, and could help the students by providing some examples of how this would work in the real world. Seeding the cloud is a favorite strategy of mine. I think students do better when you get them excited about what's coming. So in PT and OT, we took advantage of the spring semester to mention that this course was coming, to mention that they were going to get to work with other peers, to explain that the competencies which they had already learned in campus-wide experiences were going to be tailored to the allied health professions, and they were going to give you a chance to explore them through the lens of the practitioner. That got them excited. We also created numerous scripts. The faculty knew exactly what to do. They could follow along with it, literally to the point of, now cue up the video, now turn off the video, now encourage your students to discuss these 3 points. We use D2L Dropbox for all the reflections to be put in and easily graded. We scaffolded it by building a clinical experience activity that allowed them to immediately apply the things they had learned. And we continually told them to look further. It wasn't an example of learning something in a class to be tested on it or given an assignment. It was a chance to get the skills they needed to be change agents, because interprofessional practice is not a reality every place they will go. And it requires well-educated students who become graduates and practitioners to make these changes happen. And this was a chance for them to practice really seeing what's out there through the lens of the new information they've just learned. Planning and more planning. We thought starting 2 months early was a chance to make these tweaks to a course that already existed. This next year, we are starting much earlier. We decided that we need to be more transparent with each other. What are the faculty roles? What are the student roles? Who's going to do what? And our biggest change is we want to make sure the reflection activity ties in with what the students' accreditors tell them need to be reflected on. Each of us have similar but slightly different language, and we're going to incorporate that into the assignments. We have been supported so beautifully in so many levels. The only new supporter to us was Arizona State University, who created great materials that we were able to add to create an experience that moved from the hospital into the areas where the allied health practitioners typically practice. All of these other supporters have been with us through every single IPE activity, both in our college and across campus, and we couldn't do it without them.